Welcome back, my faithful subscribers, and for those who are joining us for the first time, thank you for your support. In today's topic, we will be discussing the signs and symptoms of ovarian cancer. Ever wondered what the seventh most common cancer among women is? Well, let me introduce you to ovarian cancer, a gynecological malignancy that, while relatively rare, carries serious implications. Its ranking as the seventh most common cancer among women is just the tip of the iceberg. The real challenge with ovarian cancer lies in its late-stage discovery and non-specific symptoms. And that's what makes it the most deadly among gynecological cancers. It is often diagnosed late, but early diagnosis can mean it is more treatable. Ovarian cancer affects the ovaries. It mostly affects women over 50. It can affect anyone who has ovaries. The ovaries are two small organs that store the eggs needed to make babies. Sometimes ovarian cancer runs in the families. The symptoms of ovarian cancer, such as bloating, are not always obvious. You can still get ovarian cancer if you've had your ovaries removed, because it can also affect your fallopian tubes or the lining inside your peritoneum. So let's delve deeper into the world of ovarian cancer, a disease that poses a significant threat to women's health. Are you aware of your risk of developing ovarian cancer? It is typically diagnosed at a median age of 50, but the risk is not confined to this age group. In fact, every woman carries an estimated 1 in 70 lifetime risk of developing ovarian cancer. The risk of ovarian cancer is intricately tied to the total duration of ovulation in a woman's life. This means that women who have never given birth, also known as nulliparous women, and those who started menstruating at an early age, are at a higher risk. Why? Because these conditions prolong the duration of ovulation, thereby increasing the risk. But that's not all. Other factors can also contribute to the risk of developing ovarian cancer. Obesity is one such factor, as it can lead to hormonal imbalances that may increase the risk of this cancer. Hormone replacement therapy, often used to manage menopausal symptoms, has also been associated with a slightly increased risk of ovarian cancer. Perhaps the most potent risk factor is a family history of breast or ovarian cancer. Women with close relatives who have had these cancers are at a higher risk, especially if the cancers were caused by mutations in the BRCA1 or BRCA2 genes. These genetic mutations significantly increase the risk of both breast and ovarian cancer, making genetic testing and counselling important preventive strategies for women with a strong family history of these cancers. In a nutshell, while ovarian cancer can indeed strike without warning, certain factors increase its likelihood. By understanding these risk factors, the duration of ovulation, nulliparity, early onset of menstruation, obesity, hormone replacement therapy, and a family history of breast or ovarian cancer, we can stay vigilant and proactive about our health. The more we know about these risk factors, the better we can protect ourselves and the women we care about. Did you know that there are several types of ovarian cancer? That's right. Instead, ovarian cancer is classified into various subtypes, each with its own characteristics and prevalence. The most common subtype, accounting for about 90% of all ovarian cancers, is epithelial ovarian cancer. This category itself encompasses several forms. The most widespread is the serous type, making up a large chunk of epithelial ovarian cancers. But there are others too, such as endometrioid, clear cell, mucinous, and even some that are undifferentiated or unclassified. While these epithelial cancers are the most common, they aren't the only players in the field. Germ cell tumours, they make up a small 5% of ovarian cancers. However, due to their predominantly benign nature, they represent about 30% of ovarian tumours. Another subtype worth mentioning is the sex cord stromal tumours. These account for another 5% of ovarian cancers. An interesting fact about these two subtypes, germ cell and sex cord stromal tumours, is that they are more commonly found in younger women. These cancers even have the ability to produce hormones, adding another layer to their complexity. Understanding these variations and their implications is crucial. It aids in early detection, accurate diagnosis, and effective treatment strategies. So yes, ovarian cancer is more than just a singular entity. It's a collection of diverse subtypes, each with its own story to tell. Recognizing these differences is a step forward in the fight against this disease. Knowing the different types of ovarian cancer can help us better understand this complex disease. By doing so, we can continue to improve early detection methods, refine treatments, and raise public awareness, all of which are vital in our ongoing battle against ovarian cancer. What signs might suggest the presence of ovarian cancer? This is a crucial question, as the symptoms of ovarian cancer often remain elusive, especially in the early stages. The most common symptoms of ovarian cancer, such as pelvic or abdominal pain, often don't make themselves known until the disease has progressed into later stages. This can contribute to delays in diagnosis, making the disease more challenging to treat. Along with these, early signs of ovarian cancer can be rather vague, often mimicking other less serious conditions. These can include gastrointestinal issues, bloating, fatigue, irregular menstruation, and increased urinary frequency. Because these symptoms are common to other conditions, it often leads to misdiagnoses or underestimation of the severity of the situation. Now, you may be wondering, if the symptoms are so vague, how is ovarian cancer diagnosed? Well, despite these challenges, there is a gold standard for diagnosis. This involves direct visualization and biopsy, typically through procedures known as laparotomy or laparoscopy. These procedures allow doctors to examine the ovaries and other pelvic organs, and if necessary, take small tissue samples for further examination under a microscope. Supporting this diagnostic process is the FIGO staging system, a globally recognized system used to stage gynecological cancers. This system provides a detailed classification of the disease, helping doctors understand the extent of the cancer and plan the most effective treatment approach. It's important to note that while these symptoms can be indicative of ovarian cancer, they are also common to many other conditions. So if you're experiencing these symptoms, it doesn't necessarily mean you have ovarian cancer. However, if these symptoms are new, persist, or worsen, it's always a good idea to seek medical advice without delay. In conclusion, the symptoms of ovarian cancer can be subtle and often overlooked. This is why it's so important to pay attention to your body and any changes you may notice. Recognizing these signs can lead us to early detection and potentially a better prognosis. So, how do we fight ovarian cancer? Debulking surgery is often the first line of defense. Given the nature of ovarian cancer, which tends to spread to organ surfaces rather than deep tissues, the goal of this surgery is to remove as much of the tumor as possible. This might involve removing the ovaries, fallopian tubes, uterus, and parts of other organs if the cancer has spread beyond the primary site. After surgery, the next step is typically adjuvant chemotherapy. This means that chemotherapy is used after surgery to kill any remaining cancer cells that may not have been removed during the operation. The standard for this is platinum-based drugs. These drugs are designed to damage the DNA of cancer cells, preventing them from dividing and growing. But let's not forget about the power of targeted therapy. For patients with BRCA gene mutations, a class of drugs known as PARP inhibitors can be particularly effective. One such drug is olaparib. This drug works by blocking a specific protein that cancer cells with BRCA mutations need to repair their DNA. When this protein is blocked, the cancer cells die. This makes olaparib a potent weapon against platinum-sensitive ovarian cancer in patients with BRCA gene mutations. Now, it's important to remember that every woman's journey with ovarian cancer is unique. The choice of treatment will depend on various factors, including the stage and subtype of the disease, the patient's overall health, and her personal preferences. It's a journey that requires strength, perseverance, and a team of dedicated healthcare professionals. While the treatment journey can be tough, it's a crucial step towards overcoming the disease. We continue to make strides in the fight against ovarian cancer, and each new discovery brings us closer to more effective and personalized treatment strategies. What does the future hold for someone diagnosed with ovarian cancer? The answer, unfortunately, isn't simple, as it largely depends on the subtype and stage of the cancer at diagnosis. The prognosis for ovarian cancer can be daunting, with a 5-year survival rate ranging from 20 to 50%. But here's the crucial part. Early-stage detection significantly improves survival rates. This fact underscores the importance of awareness and early intervention. The symptoms of ovarian cancer can be non-specific and often manifest in later stages, contributing to diagnostic delays. By raising awareness about these symptoms and promoting regular checkups, we can enhance early detection and improve outcomes. The fight against ovarian cancer is ongoing, but with increased awareness, early detection and continued research, there's always hope for a brighter future. Thank you for joining us on this deep dive into ovarian cancer. By watching and sharing this video, you're already making a difference, helping to raise awareness about a disease that affects thousands of women worldwide every year. If you found this video informative and helpful, please consider giving it a thumbs up and sharing it with your friends and family. Your support is invaluable in our mission to educate and spread awareness about important health issues. Don't forget to subscribe to our channel for more informative content like this. We greatly appreciate your continuous support and your active participation in this community. Your engagement helps us to reach and educate more people, and we're grateful for every like, share and comment. We also encourage you to engage with us in the comments section below. Perhaps you have a personal story or a question related to ovarian cancer or any other health topic that you'd like us to cover in future videos. We would love to hear from you. Remember to check out our other videos as well, where we explore a variety of health topics in depth. Together we can spread awareness and make a difference. We'll see you in our next video. Stay informed, stay healthy. Until next time, goodbye.